Hello, we're here with Dr. Mark Cline of Cline Family Medicine to talk about flu shots. We're not yet at the dead winter, but flu season is just around the corner. He's got flu shots. He's going to give us some more information, starting with telling us who most needs a flu shot, and we'll go from there. Hello, Dr. Cline.
Hey, Steve. Yeah, to answer your question, the folks that are most in need of the flu vaccine typically are those that are elderly or very young, or those with various diseases that can compromise their immune status, diabetics in particular, people on chemotherapy. But I'll take a moment to emphasize that it is strongly recommended for all patients, for all individuals aged 6 months and older to get the flu vaccine every year. It's an annual vaccine.
Very good. I know that we hear every year there are new strains of flu and such like that. Is there anything particular that's out there this year headed our way?
Well, it's too early to say for sure what strains are going to show up, but the ones that are in the vaccine have already been predicted by the Centers for Disease Control, and those are the ones that are in the vaccines that are available this year and being given. It's usually very accurate about the strains that are predicted to show up. Those are the ones that actually do show up. But it's a little too early to tell which strains are going to show up at this point, just because we haven't seen too many cases yet, but we're expecting them to be coming to East Texas. That time is imminent as we speak.
And I know you've got information about flus and colds on your website. I'm sure that you keep this updated?
Yes, we do.
Very good. Are there any people who have any medical concerns that should talk to their doctor before they get a flu shot?
Yes. Well, really the only folks that should be given the flu, or avoiding, I should say, where it's contraindicated, are those with distinct egg allergies. Now, this isn't people who maybe are having some minor allergy to eggs. It's more like people who've had dramatic allergies to eggs in the past, or if they've had a rare neurological condition called Guillain-Barré syndrome. Beyond that, really, there's no contraindication for anyone having the influenza vaccine by and large.
Other than what I've already heard you talk about, is there anything else you want to add about flu and or cold health care this winter?
Yeah. I would say that the two most common things that I see and hear that prevent individuals from getting flu vaccine is, one, out of a fear or concern that influenza vaccine will harm you. Many people are, feel that, hey, I got sick in the past after I got the flu vaccine. To which we tell folks the flu vaccine is a dead virus. There is no live vaccine anymore. Even this year, now the flu mist, the nasal spray that had been recommended in the past for children, is no longer recommended because it just isn't felt to be as effective as the injectable vaccine. So the only vaccine that's available is the injectable. It's a dead virus. It's not physically possible to get influenza from the vaccine. The other thing I would tell people, and this is another reason people don't get the influenza vaccines, they say, I've never gotten the flu vaccine and I've never gotten influenza, to which we tell people every day, that doesn't mean that you won't get influenza vaccine this year. The analogy we give is that you put your seatbelt on when you drive wherever you go every day, and it's not because you had a wreck last year or last week or yesterday. It's because you don't know when you may have a major automobile accident. And influenza is similar in that way. The fact that you haven't had it before is good, but that doesn't mean that you couldn't get it this year. And influenza is not a cold. It is not a sinus infection. It's influenza. It's a serious illness not to be trifled with. Influenza protects you. It doesn't harm you as far as the vaccine. And so we try, for the sake of our patients and the community at large, encourage people to take advantage of a vaccine that is very much very safe, very effective, and just ask people who've actually had influenza before. They're strong advocates of the vaccine themselves.
Very good. Once again, we've been with Dr. Mark Cline, Cline Family Medicine, talking about this year's flu season and flu shots. He's got them here. Come by and see him.